marked postprandial hyperglycemia. What is the next best step? A. Add mealtime insulin before largest meal. B. Double basal insulin dose. C. Add sulfonylurea. D. Switch to SGLT2 inhibitor. Answer A. Explanation. Adding prandial insulin is indicated when postprandial hyperglycemia persists despite adequate basal insulin. Page 534, CTC 2018. Q2. A 68-year-old woman with diabetes is on metformin and insulin. She develops heart failure exacerbation. Which oral drug should be avoided? A. Pioglitazone. B. SGLT2 inhibitor. C. DP4 inhibitor. D. Sulfonylurea. Answer. A. Explanation. Thiazolidinediones, pioglitazone, rosiglitazone are contraindicated in heart failure due to fluid retention. Page 523, CTC 2018. Q3. A 55-year-old man on insulin therapy experiences recurrent hypoglycemia. He has normal renal function but is irregular with meals. Which insulin regimen is most appropriate? A. Premixed insulin twice daily. B. Basal bolus insulin regimen. C. Basal insulin alone with oral agents. D. Concentrated regular insulin. Answer. Explanation. In patients with irregular meals, basal insulin with non-insulin agents is safer than premixed regimens. Page 534, CTC 2018. Q4. A 72-year-old woman with diabetes presents with acute myocardial infarction. Which antihyperglycemic therapy is preferred in the acute setting? A. Continue metformin. B. Intravenous insulin infusion. C. SGLT2 inhibitor. D. Sulfonylurea. Answer B. Explanation. IV insulin infusion is recommended for critically ill patients such as those with acute MI. Page 538, CTC 2018. Q5. A 47-year-old woman with type 2 diabetes has HbA1c of 8.6% despite maximal tolerated metformin. She has no cardiovascular disease and is overweight. Which is the best add-on agent? A. Sulfonylurea. B. GLP-1 receptor agonist. C. Insulin glargine. D. Pioglitazone. Explanation. GLP-1 receptor agonists improve glycemic control, promote weight loss, and reduce cardiovascular risk. Page 523, CTC 2018. Q6. A patient with type 1 diabetes develops recurrent hypoglycemia unawareness. Which strategy is most appropriate? A. Increase basal insulin. B. Switch to premixed insulin. C. Continuous glucose monitoring with insulin pump. D. Add sulfonylurea. Answer C. Explanation. Continuous glucose monitoring with insulin pumps reduces risk of hypoglycemia unawareness. Page 536, CTC 2018, Q7. A 59-year-old man with diabetes and eGFR 28 millilitremin is unable to tolerate insulin. Which oral agent is safest? A. Metformin. B. Linagliptin. C. SGLT2 inhibitor. D. Acarbose. Answer B. Explanation. Linagliptin is not renally cleared and is safe in advanced renal failure. Page 528, CTC 2018. Q8. A 65-year-old woman with long-standing diabetes presents with painful neuropathy and depression. Which single drug could help both? A. Gabapentin. B. Duloxetine. C. Ibuprofen. D. Morphine. Explanation. Duloxetine is effective for painful diabetic neuropathy and also treats depression. Page 540, CTC 2018, Q9. A 70-year-old patient with diabetes presents with severe hypoglycemia requiring hospitalization. He is on glyburide and metformin. Which adjustment is best? A. Discontinue metformin. B. Continue glyburide with dose reduction. C. Switch glyburide to gliclazide. D. Add insulin. Answer C. Explanation. Glyburide carries the highest risk of hypoglycemia. Gliclazide or glimepiride are safer alternatives. Page 523, CTC 2018, Q10. A 62-year-old man with type 2 diabetes and obesity is on insulin therapy. He is motivated for weight loss. Which option is best to help reduce insulin dose and promote weight reduction? A. Add GLP-1 receptor agonist. B. Add sulfonylurea. C. Add thiazolidinedione. D. Increase basal insulin dose. Answer. Explanation. GLP-1 receptor agonists aid weight loss and reduce insulin requirements. Page 5 of 23, CTC 20.